Acne is such a problem for so many people, and I'm really excited because today we're going to be filming about a new laser called AviClear, which can tackle acne thoroughly effectively by shrinking the oil glands in the skin. It's obviously a non-drug based treatment, and I've come to the Self Clinic in Harley Street to visit Dr. Anjali Mahto, who is using this device to find out what it's like, how it works, and what it's doing for her patients. So come along with me and we'll find out. AviClear sounds like a really revolutionary thing for treating acne. What makes it so different?
So it's the world's first FDA laser-approved device for the treatment of both mild, moderate and severe acne.
And how does it work? It's a different wavelength, isn't it?
It is. So it's a 1726 nanometer wavelength. And what that wavelength of light will do is it will selectively target the oil glands or the sebaceous glands in the skin and shrink them down.
Okay, because sebaceous glands and the oil they produce, they are always thought of as one of the causes of acne, but are they the major one that just targeting them can make such a change?
Absolutely. So if you look at the main target organ which is dysfunctional in acne, it is the oil gland.
Okay, so overactive.
That's exactly right. So yes, acne is multifactorial. We do need to think about hormones, we do need to think about genetics, but ultimately it's that oil gland that is too large, it's plump, it's juicy, it's throwing out more oil, which is causing pore blockage.
What sort of results can you get from it?
So you can get significant clearance with AviClear. Okay. So what we tend to find is the results actually, funnily enough, get better as time goes on. Okay. So a little bit of patience is required.
Yeah.
But roughly what you're talking about is at the point of 12 months after treatment, you will find that about 2/3 of people will find that their acne has cleared. So you will notice that the inflammatory acne count will go down. So what we call the lesion count.
Sure.
So the number of active spots that you've got will reduce as time goes on.
That must be really thrilling for the patient on an emotional level as well as a what you look like level.
Oh, 100%. I think that, one of the things that we hugely underestimate with acne is the mental health impacts that it can have. So it's not just about getting the skin to look better, it's about getting that individual to feel better. And you can see people's confidence improve as their acne improves.
Yeah. I mean, you know about acne on a personal level as well, don't you? Because did you used to struggle with it?
I do. I mean, I say used to, I still do.
Wow.
I was about 11 when I first developed acne, and I'm in my mid-40s now, so it's been part of my life longer than it's not. And I can very much identify that unless you've had trouble with your skin, it's very hard for people to understand how much headspace it occupies. I have had pretty much every treatment that is available for acne myself. Yeah. So not only am I at the prescribing end of it or administering end of it, but very much at the receiving end at some point in time as well. And I think the key thing is, acne can be a chronic condition. There may not be a cure for it. Yeah. So a lot of it comes down to learning how to manage it. And there may be periods that you need treatments and periods that you don't. If I think back about all the treatments that I've had over the years and actually just the psyche of the acne patient, it's incredibly frustrating to go through a treatment and then a few years later find that your skin has flared up again. Yeah. And there does come a point where you're thinking, again, why me? What's the point of doing the next one? So I think I am aware of what it feels like to wake up in the morning and touch your face and think, what else has popped up this morning?
Yeah,
I'm aware of, your first thing in the morning and first thought being my skin, your last thing before you go to bed being, oh my God, my skin.
Among all the treatments that you offer here, now you've got AviClear, who is it a good treatment for?
So I think that's a good question. I mean, I think AviClear is an excellent option for pretty much anyone that comes through our doors in that sense. We know that we can use it for mild, moderate to severe acne from a practical point of view. But that said, it's also there for people that may not want to take oral medication, can't take oral medication, can't take hormones. It may be for people that may be going through treatments like egg freezing. It may be for women that have come off the pill, are finding their acne is flaring up. Pregnancy may or may not be on the radar, so other medications may not be safe. Women going through the menopause, taking HRT, they're progesterone sensitive, their skin is suddenly breaking out for the first time, and actually maybe oral medications aren't suitable. So I think, what we're doing in practice is it's another option that we're able to give our patients so they can weigh up the pros and cons for themselves. we start the entire treatment process, it's really important that the patient's skin is completely clean.
Okay.
So it's degreased with acetone to remove any oils off the skin itself first. And then once we've done that, we apply a lot of water to the skin to keep the skin really well hydrated.
Okay.
And also the surface of the skin cool itself as well.
Yeah.
So that's why a lot of these wet gauze pads are on the skin at the moment. And what you'll find is Katie will start moving across the skin with the device, and then she'll pop the gauze back on to make sure the skin stays nice and wet. So the idea is that as she's firing, that energy is going directly into the skin, into the sebaceous gland or the oil gland to shrink it down or down-regulate it. The wavelength of light that this laser has is 1726 nanometers. Now, generally the way that lasers work is they see targets or chromophores in the skin. And in this particular case, this laser device sees just oil glands or sebum in the skin. It's selectively targeting that oil gland in the skin to shrink it down, converting that light energy into heat.
Okay, and how quickly can it shrink it down?
So what you'll find is with the treatment protocol, you need 3 treatments in total, and they're carried out roughly 3 to 4 weeks apart. And what you tend to find is results get better, funnily enough, as time goes on. So about 30% of people roughly are clear at about 3 months post-treatment. 60% around month 6 and about 90% around month 9.
What's it feeling like?
It's alright, it's not that painful. It's just around the eye, it's a bit painful.
Is it like a prickling or a stabbing or?
It's like a little tiny pinch.
Tiny pinch, okay, thank you. And is there any numbing with this?
We don't need any numbing cream usually. And the studies that we have show that if you kind of scale pain on a score of 1 to 10, most people find it somewhere between a 3 to a 5 out of 10. 3 usually, so tolerated incredibly well.
What are the key features that set AviClear apart from other treatments?
Well, I think the first thing is the fact that you can use it for mild, moderate and severe acne as a laser device. The second thing is it's a pretty quick treatment, 30 to 45 minutes and you're in and out of there. It's comfortable, it's tolerated well, you don't need any numbing cream with it, so you can come in and out. It's got pretty minimal recovery time. You can use it across all skin types, so Fitzpatrick type 1 to 6, so light of light to dark of dark skin. And I think in addition to that, the results are long-standing at up to 2 years. It's a nice solution and it really is the most exciting thing to happen in a long time in the world of acne.
So I don't know about you, but I am really excited to hear all this about AviClear. And for people with acne, what an incredible breakthrough. And thank you, Dr. Mahto, for talking us through all this. And thank you very much for watching.